Women and youths in pastoral communities are finding it hard to access schools and health facilities that are visibly far apart or not there at all.
Education and health sector, these are the key sectors determining the well-being of my people.
This follows a situational analysis on the quality and access to public service in the pastoral communities of Kasese and Ntoroko, with the key focus being on health and education.
But in the pastoral communities, they walk long distances. You find one community, they are walking very long distances because their livelihood is by nature that they have to graze their animals through a bigger stretch of land. Their citizens' right to access education services, to access health services, irrespective of where they are located. So we are not saying that the district either discriminated or avoided delivering these services, but the design also comes from the center.
As part of the findings that looked at child dropout, that looked at issues of early marriages, that looked at issues of service delivery in the areas that we are prioritizing as being marginalized, are raising other critical questions like going deeper to look at household level and the district level.
Populations in Kasese and Ntoroko districts are struggling to access schools and health centers because the area is hilly, and where it is flat, populations are scattered, and so are schools and health centers.
One primary, even no secondary school. So some children walk long distance to reach to the nearest sub-county secondary school.
Women and youths of Mpocha, Nyakatonzi, and Katwe of Kasese district are reportedly struggling to access schools and health centers that are visibly few, far apart, and ill-equipped.
A primary school that we began last year, and we are appealing to government, at least the district, to actually give us some few teachers, which we are going to do in the council for the next week. And for the health center, it is so absurd. We just have a structure. There is nothing like a health center. It is just a structure. It is just there.
To improve services in these areas, we should first look at how do we improve their infrastructure.
On those who have found out that some of our health workers, some of our teachers are always absent, some don't even come to give out services.
What is it that makes students drop out, people drop out of school? When we address when we identify the problem, we can get solutions to the problem.
Children are engaged in pet trading, like selling buvera or accompanying their parents to go to market to sell pancakes. Children are being engaged in the pastoral areas in looking after cattle on school days.
Women accessing maternity services at health centers and children traveling to schools have to bear with the long distances, slippery grounds during rainy seasons, and are sometimes attacked by wild animals from Queen Elizabeth National Park.
For example, a school like Muruti, that parish is actually around 8 kilometers from the primary school. So it becomes so difficult for a pupil to move 8 kilometers from Muruti parish to Nyakaton's primary school. That's why you see there is low enrollment. That's why we have actually school dropouts, and more especially for girls, they even fear to move. You know, within that distance, there are actually wild animals. There are elephants, there are lions. For example, last year we had a case in a point where one of our colleagues was attacked by a lion, and there was no compensation. That's why
in Butungama, Bweramule and Rebisengo, sub-counties of Ntoroko district, women and youth walk for long distances, including through Toro Semilik National Park, in order to access schools and health centers.
Construct a health unit and not think about the staff quarters. Let us not construct a school and not know where these teachers are going to stay. So we have to do a holistic planning, which should really be mindful of the fact that this is an area that needs affirmative action, where we need to have incentives to attract skilled people such that they can serve the purpose.
Because of this issue of walking for long distances in search of health centers, in some cases women retreat to traditional birth attendants for treatment, while others go for local churches for prayer therapy.
Pregnant mothers have become victims of traditional traditional birth attendants.
The situation is made worse by health workers' attitude towards pregnant mothers.
They will find somebody suffering from HIV/AIDS, they will take this person to church. But what I'm appealing to people must learn to be scientific. Yes, somebody can be healed spiritually, but the first point of reference would have been to me the hospital.
These people are very harsh. They are very rude. That's why these people are able, most communities are not using these health centers.
These traditional birth attendants, we have seen the prosperity preachers who are also entering into the domain. They are also getting themselves titles of doctors, and we are accepting,
In most cases, women risk being raped and mauled by wild animals as they move from their homes to health centers and schools through the vast plains, rugged hills, valleys, across water bodies and national parks.
There is floods. We walk in water. There is many water flooding because we are near River Semliki.
The schools that are in the islands, the children there most times suffer a lot when it comes to accessing these facilities. You have to go through a lake, you have to go through this, and there is no boat. If there is a boat, there are no life jackets.
A number of youths, mainly girls, are forced to drop out of school and are married off at a tender age, a situation that compromises their health and livelihoods.
Historically, because of the movement of these pastoral communities, some of the services like the health units, the schools, were not planned for properly. And now it's high time that we drive the attention of government into specifically looking at the young people and also the women who suffer when it comes to issues of health within the pastoral environments. The issues of Ntoroko and Kasese, you will find them in Karamoja, you will find them in Teso, in anywhere where they look after cows.
You find they are walking over 15 kilometers for younger children. So when they get the breeze, they get the motivation to say, okay, let us get work to do, get married, and just because the process of accessing a service is becoming very tense and very difficult because of the long distances that are covered. Some mothers have not gone for daily checks and antenatal care services just because they are considering the amount of time and resources invested in the transportation.
The Findings of Voice project aims at amplifying the voices of women and youth for effective delivery of quality health education services by expanding the space of influence for women and youth within the pastoral communities.
Our work is actually to create spaces to have women and youth to voice out their concerns, but also to influence decision makers to think about alternatives and also remedies that can solve all their issues.
Child marriage and teenage pregnancy are prevalent in these cattle-keeping communities and are being facilitated by lack of access to schools, most of them being distant.
Your pastoral look at the girl child in terms of getting wealth from this young girl, in terms of getting dowry and all that. So you find really we need to do a lot, and to be sure in some of these pastoral communities, education is something which is being embraced these days. At first, nobody would go to school, everybody would do grazing.
Because most of the results just released of PLOE shows that some who missed PLOE exams are those who were pregnanted and could not come. They already married. Then the issue of forced marriages in some cattle keeping communities, we are thinking that on our mobilization team, or whenever we go to these areas, at least we move with role models. Mainly we look out for those girls or successful women who have come from these communities, and we move to these communities so that they easily learn from their very own.
So the challenges we face as students, we have hardships in transport. As you can see, during the rainy season, our roads are not well developed, and you find the whole road is very muddy, and we suffer a lot. Another problem is distances, long distances. You find some students walk from far places, and on reaching at school, they are very tired, and they do not concentrate.
They are the distances of our pupils staying from very far. They just walk by foot. The area is having no water. Those are the challenges we are facing this side.
Community leaders in Rebisengo, Bweramule and Butungama sub-counties now want Health Center 3s built where residents can receive quality health care services. They also want Rebisengo upgraded to Health Center 4.
Babaire mbalengaho okundo kutuma abo kujanzaba mu byaro baiteke nakyo tukikumara government erenge kutombekera amarwaro hakiri no batembekera Health Center 2 rundi 3 ne sokuba okurwaro nkubo taito okuba amagombora bisokuba mbutukunyera baitukusange gombora kene yabutungama gombora nkuto elhamtano bakanara kandi hanu bitungamba turi haboda na Kongo nsihuki zitandikire kwiza hatu bokusange ebya helesi bitali kurungi nosanga kolera naye yamane nosanga ningenda kutureta kuja mu kikaro kinu emshuiza nyoni saba government na muno mukasumuka kandi temu amani kumbekera amarwara marungi
amasomero usanga abana baro bayingi bayina maize naito abantu bamaka bo tahire bisoro bititeito nkembuzi bintu kibyo maka aize bana musibayo paka kwikarwe baje tokabwina na maize gokunyo tokabwina na maize gokua emswija yamane izero emswija kuturuka yona vile soro kuburwa maize twenda government eferezi irwaro akwa twini irwaro na lemu no tubantu gema abana tubahimba kuno tubatwara rusengo abatarone ndubata abana tubahimba mu kugana kara hakira kaira kanu pikipiki zikaizama arona ambulance zibathaire baitu habwe abwiro bwenzura no bwiro bwekyu arokutalabana kuinga.
Kasese and Ntoroko district school administrators and health officials are being asked to monitor and inspect health facilities and schools continuously so that attendance and absenteeism are checked.
Should anyone be found that is not working well, definitely we are calling him and we are warning him or her. Should it be 2 times that you are getting warned, definitely we shall discharge you, and we are doing this.
They have more time to concentrate on the domestic cause that affects. Yes, I also believe when it comes to absenteeism, again it comes to inconsistent attendance. Then also our staff who have got challenges. Where we don't have staff houses, of course they are being affected by long travels, long distances. But even where we have staff houses, the teachers have not even occupied these staff houses.
There's been a tendency of teachers and health workers going for further training without authorization. So you find, you reach a station, you find a teacher, you hear is on a study leave but without authorization. These ones have given warning letters.
District officials are also being challenged to block teenage marriages and school dropouts.
We have mandate to supervise them, or inspectors are supposed to reach them and supervise them and write reports on them because they are under our docket.
Please work with the police, arrest these children who are loitering, who are not going to attend school on Thursdays and other market days.
This is after lack of supervision was identified as an issue affecting standards of education in cattle-keeping communities.
Community members, they still believe in marrying off the girls. Even if they are not the ones who are marrying them off, if they witness a case where a girl is getting married, no one is bothered to report. And they take it normal that a girl is supposed to get married and it ends there. Thus, the party is done and no one is bothered even to report that a P7 or a P6 people is being married off.
We need a spark. We need to be angry about the hemorrhage that is being done to our girl child. Even the boys who are not going to school, they are going to be enslaved forever. We need to get to that level of anger so that we can cause a spark.
Chairpersons should be able to monitor and look at those children who are not in school, especially the school-age going children. Now, we are going to arrest and give fines to parents and guardians whose children are not found in school. And of course, it has to be a role of LOCs because they're the ones who are ever in the villages, but also working hand in hand with the parish chief, the sub-county chief, and also with the RDC. So
the Parliamentary Education and Health Forum wants special treatment for persons living in hard-to-reach areas where most children reportedly drop out of school due to neglect by parents and guardians. About 44% of school dropouts are reportedly due to parent neglect.
I just want them to change their mindset. Education is the way to go. Take more children to school. That is how we shall build and develop.
This is a big concern. We need service delivery to our people. Our spending in Parliament is as good as useless if our people do not receive the required services.
We need to improve on the road network so that roads, even in the mountainous areas, can be everywhere. Because currently, the road network only leads to an institution of government where there is a health facility, where there is a sub-county, but you can't find many of them in every village so as to be getting whichever patient that we could be targeting when an ambulance goes there.
Children write exams on the ground. Supposing they were uplifted a bit, they would be better. They would perform like schools within Central.
But what is important is for government to really look into the plight of these communities, to see how innovatively they can be able to adopt to some of the new enterprises that can enable them to settle down and then be able to develop.
Access to quality health and education in pastoral communities of Kasese and Ntoroko are arguably still below the national average, a situation that may demand a policy shift by way of intervention.
The biggest challenge we're having, people can be convinced that the cattle keepers are not poor because they're seeing there are very many cows being raised. But to assure you, you find somebody is having 8,000 heads of cattle, he's only a single person. The rest of these people grazing, these are just grazers and who are paid less.
Some didn't send their children to school due to lack of school fees. You know, we cattle keepers, we don't have any business we are doing, we only depend on cattle. We request the government to give us a secondary school and support our girl child.
The pastoral communities are relatively wealthier than other communities. Where is the problem? Are we valuing the animals more than the children?
The people are not going to school. They are going to market. They take their cattle to market. Others, we there in Tungama sub-county, we are on the border, so others are going to fish.
Now, what do we do? The ministry is thin on ground, and this is a fact. They don't supervise routinely, we don't see them, and the level of collaboration is also not very visible. Work with police, arrest these children who are loitering, who are not going to attend school on Thursdays and other market days. Education department is joining hands with these people, make sure that at least we put a mark on this and we should be on record.
Kabarore Research and Resource Center presented the situational analysis of youth and women from pastoral communities of Ntoroko and Kasese with a focus on education and health aimed at amplifying the voices of women and youth for effective delivery of quality health and education services in Ntoroko and Kasese district.
Are scattered. So if you use a population aspect, it means that those communities will not have schools, will not have health facilities, just because the size of population is not very big and people are moving long distances.